Mr. President, when a pope dies, the cardinals meet in secret to select the next pope. A white cloud goes up in smoke. When Senate Republicans meet in secret to craft a health care bill, coverage for the sick, the disabled, and the elderly, that's what goes up in smoke. All of that coverage. The only thing more secret than the Republican health care bill is Donald Trump's tax returns. And we might need, ultimately, to have a special counsel to go and to find out what's inside of that health care bill. Because right now, the Democrats don't know, the American public doesn't know, no one knows what's in that bill. And while we may not have details on the Republicans' secretive proposal to repeal and replace the Affordable Care Act, we know that they are not completely rewriting the House-passed legislation that eviscerates the Medicaid program and reduces coverage and increases costs for most Americans and for the individuals, the families, and the communities caught in an opioid crisis. This bill will be a complete calamity, and it's being done totally in secret. Right now, the press is being stifled. The White House didn't even let reporters audio tape the press briefing today. Last week, the Senate Republicans tried to keep the press from asking questions of senators in the hall. They don't want the press to know about this bill or to cover it. But for families who could need treatment for opioids, the Republicans want to take the money from substance use disorder coverage and care and to use it to offset a $5.5 trillion tax cut for the healthy, wealthy, and for massive corporations. That would be cruel, it would be immoral, it would be inhumane. And like President Trump himself has said, it would be mean. We know the opioid epidemic knows no demographic, economic, or political boundaries. It has ruined lives of men and women from Lexington, Massachusetts to Lexington, Kentucky. It is an equal opportunity destroyer. That's one of the reasons why, over the last year, combating the opioid epidemic has been a bipartisan issue. 11 months ago, this body passed and sent the President's desk the Comprehensive Addiction and Recovery Act, known as CARA. This bipartisan law strengthens the state's responses to the opioid crisis and passed the Senate 92-2. And 6 months ago, the Senate passed the 21st Century Cures Act bill, 94-5. This bill quickly became law and allocated $1 billion to states to provide much-needed resources to help them address the opioid epidemic on the ground and in their communities. Yet today, Senate Republicans are single-handedly attempting to betray that progress, to erase it from the history books. They are doing so by crafting in secret a bill to gut Medicaid and repeal the Affordable Care Act and replace it with a shell that hides a massive tax break for the wealthiest people in our country, people who do not need or deserve a tax break, especially if it's coming from the health care coverage from those people who are sickest, those people who are oldest, those people who are most disabled, those people who are most vulnerable to having an addiction to opioids and need treatment. It would be wrong to take their money for that health care coverage and give it as a tax break to the wealthiest billionaires in America who already have enough money for their health care coverage. That would be a death sentence to the 2.8 million Americans with substance use disorders, including 220,000 with an opioid use disorder at risk of losing their insurance coverage altogether in order to ensure that their family member could get treatment. For those who do manage to get insurance coverage, Trump Care will make it more expensive to get the treatment and the care they need. The Congressional Budget Office explicitly said that out-of-pocket spending on mental health and substance abuse services could increase by thousands of dollars per individual in any one given year. For a disease as critical as an opioid use disorder, any delay in treatment can be the difference between life and death. Not to mention that because Trump Care reduces protections for people with pre-existing conditions, even those with insurance may find out that the coverage they have won't work for them when they need it the most. Under the Republican proposal, a substance use disorder could be classified as a pre-existing condition, and therefore, you can't get coverage for it. The Congressional Budget Office also said that Trump Care would slash Medicaid by $834 billion, permanently decapitating Medicaid. Decapitating. They say they're moving to a per capita system. Another way of saying that, if you're an ordinary person, is decapitation of Medicaid for the families across our country who need it. And if this becomes law, there is no Narcan for Medicaid. Once it's cut by Trump Care, it is dead. Those devastating cuts would grind the progress we've made in expanding access to opioid treatment to a screeching halt and kick people currently in treatment to the curb. Medicaid spent $7 billion on substance use disorder treatment alone in 2014. That money facilitated access to care, access to recovery, and access to hope for millions of Americans. Medicaid can cover inpatient detox treatment, care coordination, access to naloxone. And additionally, Medicaid pays for 1/3 of the medicated assisted treatments in the country, more than any other payer. In Massachusetts, Medicaid pays for nearly 1/2 of the medication-assisted treatment provided in the Commonwealth. So think about that. 1/2 of the people who get medicated-assisted treatment for opioids, for addiction, will lose their coverage, and then the Republicans are going to take the money they save and then give it to the wealthiest people in our country who also need the same coverage, leaving them with the money needed for those who are the other 1/2 who won't have it. And what happens to those other individuals? It could be a death sentence without treatment. And those of us from states hardest hit by the opioid epidemic hear time and again how Medicaid coverage of those services saves lives. Dawn from Swansea, Mass., shared the story of her son who became addicted to opioids after experimenting with prescription pain pills from a family member. Through Medicaid, he was able to access medication-assisted treatment to help treat his substance use disorder. Dawn said, quote, "He has done very well with his recovery so far, but I fear that without insurance coverage, that will allow him to continue obtaining his medication and counseling. He may lose all that he has gained and fall back into the cycle of addiction. His medical insurance is literally his lifeline. Please don't abandon my son and others like him who need Medicaid assistance to continue their fight against addiction." Instead of recognizing the importance of Medicaid for families like Dawn's across the country, Republicans are proposing to starve this life-saving program from federal funding through Trump Care by cutting more than 1/4 of its budget. And because that's not enough to fund the massive tax breaks that Republicans want for their donor friends, President Trump has proposed in his budget to cut the program by an additional $600 billion, leaving Medicaid a shell of its former self. Although Republicans refer to these changes as capping the Medicaid program, for Dawn's son, what that really means is they will decapitate his access to medication-assisted treatment, decapitate his ability to seek counseling, and decapitate the peace of mind Dawn receives in knowing her son is accessing the help which he needs. We also have to consider the Affordable Care Act's Prevention and Public Health Fund and its role in the opioid epidemic. It is the federal government's single largest investment in prevention. Since 2010, Massachusetts has received more than $95 million through the Prevention Fund. Importantly, for Massachusetts, nearly $4.5 million has been given to the Preventative Health Services Block Grant that has helped the state respond to the heroin, prescription drug, and fentanyl crisis. Eliminating this fund will only hurt our ability to respond to the opioid and other drug epidemics popping up in every one of our communities. We should not be building bridges to recovery with money that is stolen from those programs in order to be spent on a wall that is going to pretend to block the drugs from coming in from overseas. We should be building bridges to recovery, not walls to isolation. And instead of more commissions, we need more commitments from the administration and congressional Republicans to not undo the progress we've made in preventing and treating substance use disorders. It's unfortunate that Republicans who've touted our progress on opioid issues aren't standing up to the policies in Trump Care that would negate their hard work. By supporting this, they are betraying the families and communities who have suffered from the relentless grip of substance use disorders. When discussing the opioid crisis, the only thing the GOP stands for right now is gutting overdose prevention. That's the new GOP, gutting overdose prevention. While devastating, this isn't surprising for those of us who have been watching many congressional Republicans salivate over ways to annihilate Medicaid for decades. Republicans harbor an ancient animosity towards Medicaid. Raiding the Medicaid coffers achieves two of their goals. First, it kills a lifeline for more than 70 million low-income and working-class Americans. And second, it provides the GOP a piggy bank to aid their donors and pay for these tax breaks for their friends. In fact, Trump Care alone would provide the wealthiest individuals and national corporations with over $660 billion in tax breaks over 10 years. Included in this figure is the repeal of the health insurance tax, which gives a $145 billion tax break to insurance conglomerations and their CEOs. Millionaires will get a tax break of $50,000 per year, more than 3 times the income of most Medicaid beneficiaries, and the top 400 highest income earners would save $7 million in taxes annually. All of this comes at the expense of the 23 million Americans who will lose health insurance coverage under Trump Care. Don't let the GOP fool you. Trump Care is not about creating health. It's about concentrating wealth in the hands of a small number of Americans. It's about making middle-class and working Americans pay for a tax break for people who need it least. We can do better than this. We owe it to the families of the 33,000 Americans who died from an opioid overdose last year. The proposals under consideration with Republicans is going to only add to the tally of overdose deaths. We're hearing that Senate Republicans could create an opioid fund as a paltry attempt to appease those who have called out the cruelties in this bill. That extra funding would be crumbs. It would be like trading a full-body cast for a Band-Aid, like trading land for a couple of beads, like trading a Cadillac for a tricycle. We will not be fooled. We know it took Republicans more than a year to agree to providing the funding for emergency opioid response in the Cures bill. One can only imagine how long it will take to get any money the Republicans are promoting as a consolation prize out to the communities who need it. We know a vote for Trump Care is a vote to perpetuate overdose deaths. Passing this bill will be just aiding and abetting one of public health's most wanted and most notorious serial killers. Americans from both political parties are not fooled by President Trump's tax cut shell game on the backs of families and communities that have been ravaged by opioids. That's why Democrats will continue to be a public megaphone and shout from the rooftops that eviscerating Medicaid to give a tax cut to the healthy, wealthy is mean, it is inhumane, it is immoral, and we are not going to stand for it, and the American people are not going to stand for it. The best vote I ever cast in my political career, that's 41 years in Congress, was for the Affordable Care Act. The second best vote I will ever cast is to block the repeal of the Affordable Care Act because of the good which it has done for tens of millions of families in our country who otherwise would not have the coverage they need. Mr. President, I yield back the balance of my time.